uncover history's dark secrets. Join us as we delve into 5 of the most bizarre practices that once existed. Our journey starts with a look at pseudoscience of phrenology, the art of head reading. Once, it was the hot new belief that the shape of your skull could tell you everything you need to know about your personality and mental abilities. This was based on the belief that the brain was made out of muscles that grew bigger the more you used them. Can you imagine having someone feel the bumps on your head to determine if you were intelligent or not? Phrenology practitioners would examine the head and feel the specific bumps and indentations which they believed corresponded to different traits and abilities. This practice was so popular that people would pay to have their heads examined and receive a detailed report of their strengths and weaknesses. It even made its way into the job market, with employers using phrenology to determine which job applicants were the best fit. Thank goodness that today our dream jobs aren't determined by the bumps and curves on our skulls. Alright, let's dive into another wild and wacky chapter of history. When doctors tried transfusing blood for the first time, the reactions were so adverse due to lack of knowledge about blood types that doctors stopped the practice. Later, a unique idea became popular among medical professionals that milk could be used as the substitute for blood. The idea was that the fatty and oily qualities would transform into white blood cells once injected into the body. Most of the patients who received milk transfusions died soon after, and some were complaining of chest pain, headaches, and repetitive eye movements. Despite poor outcomes, milk transfusions remained popular until one doctor conducted experiments on dogs and found that animal milk was causing adverse reactions in them. Fortunately, the blood types were discovered and the practice was eventually abandoned. If you think today's beauty trends look crazy, then you should learn about this trend from Tang Dynasty in China. This practice usually was done on girls as young as 5 years old. First, an auspicious day was selected and older women of the family gathered around. The process was usually done by an older, experienced woman in the family. The big toe was left facing forwards while the other 4 smaller toes were tucked underneath the foot by her. In this position, she would tightly bind the feet with cloth strips to restrict growth and form a pronounced arch. Losing toes, foot infections, and gangrene were just some of the common side effects. The goal was to make feet as small as 3 inches long. Could you imagine an adult with a foot that size? So, what was the purpose? Foot binding was widely used to set upper-class girls apart from commoners. Then, even the lower classes started getting in on the act and hoping to improve their social status. Foot binding increased the girls' marriage prospects. Could you imagine dragging around unbroken, distorted feet just to be considered pretty? Trepanation, also known as trepanning, is an ancient surgical procedure that involves drilling a hole in the skull. People believed that trepanation could cure a whole host of ailments from migraines to mental illness. Some even thought it could bring you closer to the gods. Despite the gruesome nature of the procedure, trepanation was a surprisingly common practice. Some folks were so convinced of the benefits of trepanation that they even did it to themselves to enhance their mental power and well-being. Because they didn't have the fancy surgical tools we have today, they used whatever they had handy, like chisels and hand drills. It is a relief to know that trepanation has been replaced with the more advanced and safe procedure of craniotomy, a safer method of temporarily removing a portion of the skull to remove fluid and relieve pressure. If you are enjoying this video, give us a big thumbs up by hitting that like button and subscribe to our channel. And back to the topic with another hilarious medical breakthrough by our ancestors. Every time you have heard the phrase blow a smoke up someone's, you might have wondered why in the hell someone should do that. Tobacco smoke literally was blown up people's rectums as a first aid kit for resuscitation. This medical toolkit was distributed and hung along River Thames and included bellows, fumigator, tubes, nozzles, and its secret ingredient, tobacco. Whoever was recently drowned in the river was resuscitated by inserting the tube in his bottom and connecting the bellows to the fumigator to blow the smoke into patient's rectum. The warm, dry vapor produced by burning tobacco and nicotine was thought to restart lungs and hearts, especially as it passed through rectum and into the intestines. How exciting! It is a relief for swimmers to know first aid has come a long way since to more effective techniques. Okay, that's all, and see you in the next video.